how would you say that media coverage of HIV and AIDS has changed, say, over the last 40 years? Yeah, it's been that long. Uh, and what do you think attributes to a shift if you've seen it? We'll start with Mark.
I think one of the things I've seen in a couple of years is some deep dives. So about 2 years ago, there was a New York Times Magazine article that focused on HIV in Jackson, Mississippi. Um, we have done a major project in Jackson, Mississippi for a long time, and so know that community very well. Um, and it did do a deep dive. I think one of the things I'd like to see in coverage is that coverage is rare. I think it's great to have that at that level. But I think that I would like to see more follow-up, quite frankly, in terms of looking at not just here's the sad situation, but here's the way out, who's accountable, who's supposed to be responding to the epidemic locally, and what can people do. And I think one of the things on the ground people often say coast to coast is that I didn't know about HIV, until I seroconverted. So I think there's also a need for people to have information about where to go, because it's, if you aren't in the field, you probably wouldn't likely know. It's like if I had to learn about diabetes tomorrow, I might not know the first immediate steps. And so those are a few of the things I think about the coverage. I think it punches through every once in a while, but I think there's not a sort of strategic focus, if you will, about the way forward.
So Andrea, I think if I think about having been in the field for a long time, I've seen the evolution of coverage. In the beginning of the epidemic, it was covered as if it was a disease of gay white men. And we saw sort of a shift over time where you started to see these articles that talked about the changing face of HIV and talking about Black and brown folks. But in reality, Black and brown folks were always disproportionately impacted. And so from the beginning, we didn't see enough of those stories. But over time, we have seen more and more coverage to the point now where most of the time, if there's an article, it is talking, as Mark said, sort of about the sad situation happening in communities of color, not talking enough about sort of what's good news, what's happening that's positive, where have we made progress. But I would shout out to people like Linda Villarosa, who covered HIV in the Black community for New York Times like many, many times and made the effort to get it right by talking to providers, talking to folks who were infected, talking to at-risk individuals. And so, it certainly has been done right in many settings. But as you point out, Andrea, it's clear that right now, none of that's coming through because everything's COVID.
Yeah, I couldn't agree more. I mean, I, as a person who's been living with HIV myself for the last 17 years, did not really know or hear much about HIV until I found out that I was HIV positive myself. It was a vocabulary word in a small health class that actually even didn't spend that much time on infectious disease. And it was really my own diagnosis that brought it into my life, that made me more aware. And then it was, over a decade after that before I started seeing it integrated into storylines, into media in a more robust way. One of the missed opportunities, I think, is that the HIV epidemic over the last 40 years has just evolved so much. We've evolved from a time where HIV was about dying with, and then has evolved to living with, and now is actually about thriving despite, but that's not the message we really see in the media, especially when we're talking about the impact on communities of color.
I'm echoing all of you guys, especially what you just said, Tyler. The beginning 40 years ago was definitely dying from and fear and keeping our kids out of school, because what if you pass by some, as if it were airborne. It got the kind of coverage back then, fear coverage, that COVID kind of got this past year. And now, with the exception of Linda's occasional deep dives in the New York Times and wherever, you don't really see much coverage on occasion, even before COVID. It's a chronic condition, and young folks don't even know that 40 years ago there was this fear and panic. And so there aren't the stories of how to not get it. There aren't the stories of how do you get it. There aren't the stories of, people thriving with the disease. We're not getting those stories.